Michigan's Children proudly presents Speaking for Kids, the podcast where we explore crucial conversations impacting the lives of all Michigan children, youth, and families, especially the most vulnerable. Join us each month as we explore public policies and issues in the best interest of our kids and families. We'll bring you lawmakers and policymakers, advocates fighting for change, and the people most affected by those decisions. With our host, Matt Gillard, President and CEO of Michigan's Children, we'll invite you to become engaged too and show you how to take action on what matters most to you. Episodes are recorded live and shared virtually on YouTube and the audio hosting sites Apple Podcasts, Google Podcasts, and Spotify.
Hello, I'm Matt Gillard, the President and CEO of Michigan's Children, and welcome to another edition of Speaking for Kids, your monthly podcast series brought to you by Michigan's Children, where we go in depth on an issue that's important to kids and families here in Michigan, and we'd like to bring in experts to talk about the issue and have a conversation about what's happening around that and how advocates especially can get more involved and engaged in making Michigan a better place to be a kid and raise a family. And so we're excited today to have two very important folks in this world that we're going to be talking about child abuse and prevention. April is Child Abuse and Prevention Month here in Michigan. Some of you hopefully have been seeing some beautiful blue pinwheels around in your communities and hearing a little bit about what's happening around child abuse and prevention here in Michigan. So we're excited today to be joined by Suzanne Greenberg, who's the Executive Director of Children Trust Michigan, a good friend and partner of ours at Michigan's Children, as well as Bart Klicka, who's the Chief Research Officer at Prevent Child Abuse America. So welcome, Suzanne and Bart. Why don't, Suzanne, you just introduce yourself a little bit and tell us a little bit about Children's Trust Michigan.
Thank you so much, Matt. I'm just thrilled to be here and thrilled to be here with Bart and looking forward to this exciting conversation. Our organization has existed since 1982, and the dedication to preventing child abuse and neglect has never changed. Our mission words slightly change, our name has changed, but frankly, it's always about preventing child abuse through strengthening families, and we do that in the local community. So we have over 80 partners that we work with, and they are busy in their communities identifying the needs and providing those programs that meet those needs. We provide them the support, whether it's education, resources, financial, expertise, and training. The bottom line is we want to make sure that they are that strong voice in the community for prevention, and the only way to do that is to make sure they have what they need. And so it's our pleasure to serve that way from Lansing, but our mothership, I lovingly call it, is one of them is Prevent Child Abuse America. And I'm just thrilled that Bart is here to join us.
Great. So thanks. Yes, thanks, Suzanne, and thanks for the work that you do. And Bart, why don't you tell us a little bit about Prevent Child Abuse America and your role there?
You bet. So thanks for having me on here today. This is great to celebrate Child Abuse Prevention Month here in April and all the amazing work that's going on in Michigan and elsewhere. I serve as the Chief Research Officer here at the national office headquartered here in Chicago. Prevent Child Abuse America has been around since 1972, headquartered here in Chicago. And really, we exist for the primary prevention of child abuse and neglect, meaning that we are working upstream, so to speak, to ensure that no child experiences abuse or neglect. And we do our work through two very powerful national networks. The first one, as Suzanne was talking about, is our state chapter network. We have chapters of our organization across the country. And as you heard, they're really the ones on the ground getting into communities, helping support the types of community-based strategies that are necessary. Also working at a state level to ensure that we have the policy context that supports kids and families. Our second network is our Healthy Families America evidence-based home visiting program. We have over 550 Healthy Families America sites across the country, serving about 70,000 families per year. And at the national office, we provide support to our various networks on ranging from how to implement our blueprint for family well-being, which is really our theory of change for how we ensure that all children and families are living a purposeful and happy life with hope for the future. Where I sit in the organization, I provide support and technical assistance around areas of research and evaluation. And we have a policy team that helps both at the federal level, but also at the state level to ensure that we have the policies that we know support kids and families. So thrilled to be here. Thanks for having me.
Awesome. Awesome. Well, thank you as well, Bart, for the important work that you're doing. So let's dig into this a little bit, Suzanne. So you and I both know, and I mean, this is an issue from an advocacy perspective, right? That sometimes can be very frustrating because unfortunately, the time when most people pay attention to child abuse and neglect is in response to some tragic case that gets media attention and gets public, and creates public outcry. And obviously that's the reality of the world we're living in and the media that we're living in, and we do what we can to respond to that and to try to build off of that engagement and interest from the general public to create policy opportunities to create better systems. But we all would be much happier if we were able to get that attention and get people focused on the primary prevention end so that those stories never happen and we never have to hear about them. So let's talk a little bit about what primary prevention looks like right now in Michigan, and then we'll get into with Bart maybe about what some other states are doing and what primary prevention could look like in Michigan with some better policies and better investments.
I absolutely love the vision of and the visual, excuse me, of the upstream. I'd like to say upstream and up out on the bank. Like we don't want any harm to happen to children. How can we help that from happening? Well, it is really about strengthening families, really about empowering them to be and ask for what they need and meet them where they are, but to strengthen the unit that they are so that their kids can be safe, happy, and healthy in their community. And who knows best about their community? They do. Who knows best about their family? They do. Programs like Healthy Families America, we have those programs around the state of Michigan. So we partner with them throughout the state. We are not the oversight of that particular program, but we certainly are very well aware of its expertness and expertise in preventing child abuse. The bottom line is primary prevention, as you know, is well before any harm. We absolutely don't want harm to happen to children. So how do we do that? Really, it's about strengthening the family, but also educating. Last year we educated over to almost 250,000 parents in infant safety and education. Like we don't, as you just have a child and all of a sudden you know what the child development expectations are? Of course not. We have to educate that. Do we know that a baby cries on average 5 hours a day? We don't know that. So we have to educate and support parents through that in a lot of the questions that they have, but also that general parenting classes and education, over 160,000 across the state were educated last year. That's important because it's being done in the community in the response to the needs they have. We can do that whether it's done in the schools, the hospitals, et cetera, or it could be through family resource centers, which we've been challenged to fund in this state, and we're still trying to get traction. But the truth is the value there is it welcomes all, any question you have, anyone in the community, and that I believe is the absolute importance and critical nature of primary prevention. What is it that you need and how can we, it's not a handout, it's a hand up. It's about making sure that they have what they need to be the best parents possible. Hey, listen, I can look back not that long ago and remember sometimes some moments are tough and people go, oh, isn't parenting lovely? It's beautiful. How lucky you are. Yes, all those things are true, but that doesn't help me at 2 a.m. when I've done everything that I've read about and it's not making the baby what seems to be comfortable, when in fact it's just the fact that they're going to cry. So those simple things of education, Matt, make such a difference. And supporting and funding primary prevention is a very limited avenue here in Michigan. And we're proud that we support that. That is where our primary dollars go when we raise them in an auction, when we have them from the Children's Trust Fund. The truth is we put the majority of those dollars into primary prevention and then also support the secondary prevention for programs like Healthy Families America, if they're working with families that are at risk. That's where some of those dollars go as well. But we would prefer that we could put every focal point on helping kids and families before any harm happens.
Absolutely. And I think the unfortunate reality here in Michigan is that we do not support that enough with enough state resources. And I've been saying for years, and Suzanne, I know you've heard this, is that it's a travesty because in reality, in the terms of a state budget, I mean, we're in the midst of the state budget conversation right now in Lansing. We're talking about very small numbers in the midst of an $88 billion overall state budget that can make a huge difference. And I think the framing that you use and that we use, I think collectively on this is important. This truly is family support. When we talk about primary prevention, it truly is family support. And and I think, there's some misconceptions maybe about folks about what you're talking about when you're talking about primary prevention of child abuse. And we have historically as a state not committed real state resources to this. We've done things like, and we continue to do things like your organization's a wonderful auction, and we've done the income tax checkoff, that
Mhm.
people used to be able to, or still could, I guess, but nobody files, paperwork anymore to do taxes, and it makes it very difficult. We had the
Mhm.
license plate where we were generating some revenues, but now there's 100 license plates that people can choose from, and
That's
so
right.
that's not raising the revenues that we used to. And it really, I mean, where we should be doing, and I know what other states are doing, is investing real state resources into some of these programs. So Bart, let's jump into that. So what does the research show you from Prevent Child Abuse America on, the value on investing in primary prevention, and maybe what are some of the ways other states are looking at this differently and making some real progress in this area?
You bet. I think Suzanne hit on so many important points. And as we think about what is primary prevention and what does that look like, it really means making sure that families have what they need before they find themselves in crisis. And the way that many of our systems are set up, a family needs to experience a crisis before services and support are provided to them. And so we envision not one single approach, not one single strategy for the prevention of child abuse and neglect. And that hits on a second important point, I think, that Suzanne made, which is, and the tagline of our organization, centering families at every turn. We oftentimes build policies and programs for families to address problems that families are having, but we don't have families sitting at the table telling us what their lived experience is of having to navigate the systems and the policies and the roadblocks and the barriers that we put in place that make it very, very difficult for them to receive the benefit of the program or the policy. So I think very important things that prevention really is community specific. People in the community know what's best. They know what they need. They know what resources they have, both formal and informal. We sometimes underestimate the informal supports that communities have that really uplift kids and families. But when we think about what is needed and what's being done across the country for prevention, and even some of the work that I've done with people out of Michigan, Dr. Katie McGuire-Jack out of the University of Michigan is one of my close collaborators, where we've evaluated policies as prevention strategies. So we know that policies like paid family leave and childcare subsidies, these reduce different forms of violence, child maltreatment, intimate partner violence. But the list is larger than that. It's things like Medicaid, it's things like minimum wage, earned income tax credits, all of these things that can help increase the economic stability and mobility of families. So that's one set of strategies that states are working on and really making some progress. But as Suzanne mentioned also, we have states who are working on things like family resource centers. Family resource centers really being a place where families can come get what they need before they find themselves in crisis in a very non-stigmatizing way. When you offer a service to an entire community, not based upon whether or not you're experiencing some type of crisis, but when it's open to everybody, it removes the stigma associated with that service. And so some people are expanding their family resource networks, but also, for families, sometimes they need a bit of information about child development. I know that when I had a child, and I remember the nurse handed me the child, and I was like, oh my gosh, I've done all this reading and been in school forever, and I don't know what the heck I'm doing. And it's the fact that every family needs support. The type, timing, and quantity of that support differs, but every family needs support. And that could be home visiting, it could be family resource center, it could be housing support, it could be connection to food, SNAP, something like that. But we need to make sure also that families have access to things like healthcare, to mental health treatment, to substance abuse treatment, that we make these available to families and we start working on shifting public perception or shifting mindsets around the use of these services. And so they're no longer stigmatized, because I think that many times these services, even something like voluntary home visiting, can carry stigma with it. And so we have to work on shifting mindsets so these types of things become the norm.
Absolutely. And I love how you talk, and you both of you have referenced that, these approaches are community specific, and that's something, we realize and I think deal with in Michigan even more so than most states. I have colleagues from around the country doing similar work, but Michigan is an extremely diverse state, both geographically, first of all, but yet socioeconomically and everything else. And so I think that's a benefit of the structure that we have in place, Suzanne, with the local involvement, the local networks that you have. And so we are set up to be able to take advantage of these unique community needs. But it still comes down to, a commitment and a prioritization, really at the state level. And especially now when we're seeing a lot of the funding from the federal end being at risk or being targeted for cuts and reductions, and certainly not being as big of a priority with our current federal government. It's even more imperative that we see some progress here at the state level. So let's dig into that a little bit, Suzanne. So give me your hopes and dreams. If everything were to work out fabulously in this budget process that we're in the midst of right here in Michigan, what would that look like for Children's Trust Michigan? What would we be hoping to see in our wildest dreams here?
Well, here's the thing that Children Trust Michigan is so clear about in our partnership with PCA, with Michigan's Children, and all the hundreds of others that we work with every day in this work. There is nobody who's doing this alone, right? Prevention is only possible with partnership. Bottom line, Dr. Merrick at the helm of PCAA has said that since the day that she walked into that office, and she came to us from the Center for Disease Control, and there was so much clarity about that. I'm like, those are the words I've been looking for. The truth of the matter is that we know this, and so the dream is that the state legislator would totally embrace that. We would be excited to look at a portion, to prove prevention by getting a portion of the dollars that are spent on after services, $400 million on foster care. What if we had 1% or 5% of those dollars moved slightly into prevention and make the case that this works, that we can keep children out of the system? And not only that, we can strengthen families so they never have to get in the system, that if they come for assistance, it's that one horrible thing that happened. They need a little assistance, housing or food for that temporary hardship that they've experienced, but there's not harm to children, right? This is not about coming to the system because the child has been harmed. My dream and wish and hope is that people would embrace prevention and that this works. It works in smoking cessation. It works in weight control. It works in all the other things, drugs, et cetera. We're working on it and we are investing in it. It is time. It is Michigan's time to say enough's enough for these stories you talked about. Matt, I sit in a public awareness meeting where we talk, someone always highlights a story out of Michigan of a horrific thing that's happened to a child. Enough. It's really too much. I've experienced it myself as a child. I really don't want to leave this earth one day knowing that we didn't change that barometer. We didn't make that change enough. We have changed it, but we need to change it more because kids shouldn't suffer. They shouldn't suffer in the state of Michigan, but they shouldn't suffer in the United States of America. They just like that. They should not.
Absolutely. And I mean, and the I think tragic irony is that those conversations always start with, how can we prevent this? How can we prevent this? Well, the way to prevent this is to get serious now about investing in these primary prevention programs.
And Matt, people like Bart and his colleagues have the research. They have the proof. I have it, but they are the experts that are doing it. So we have the proof. I want to put Bart right in front of it. Like, listen to this. I can put the papers out, but I didn't stand there and do the research. And the truth is we have it now. We didn't have it 15, 20 years ago. We have it. So anyway, I apologize. I could talk.
No, that's great. Absolutely. So Bart, there it is. So, our audience is mostly advocates, right? I mean, people tuning into this podcast are people that care about kids and families and want Michigan to be a better place to be a kid and to raise a family. So what would you tell these advocates is most important for them to let their policymakers know, to let their elected officials know, or to let their candidates know that are going to be running for office or that are running for office in this big election we have coming up here in November? What should they know? What are the one or two things that they should have top of mind when they're talking about either to current elected officials or to candidates for office around primary prevention?
It's a great question. When I think about policies, I think about policies as choices that decision makers make. And we want to forefront children and families as the choice that is made in our policy and programming process. We want to put children and families first in that process. I think in order to do that, there's a few things that we need to simultaneously work on. First and foremost, as Suzanne mentioned earlier, we talked about, it is centering families. As much as, Suzanne, you might want me to stand up and talk about research, it might bore some people. But really what changes hearts and minds is when you can put an experience to some of the numbers. I think that we need to think about how do we center the lived experience of families, of communities around these policies, talk about how families have navigated this, and not just families who have been involved in deep end systems, but getting those who have gone through our home visiting programs, those who have experienced the benefits of a family resource center to come and talk about how these were integral in them never coming in contact with one of our deep end systems. So really centering families, blending stories with some of the data that we have, I think is so important. And in general, I think as a country, we make decisions based upon how we think problems occur and how they're solved. And if we believe that child abuse and neglect is a bad parent problem, we're going to develop strategies that are very punitive towards families or punitive towards communities. The science shows us that child abuse and neglect is not a bad parent problem. It has to do with a complicated set of factors and really pushes us to think about how do we create the conditions where families can be successful. And when we think about that as a driving force behind child abuse and neglect, that opens up the possibilities for very different types of strategies than just punitive downstream options. It opens the door for thinking about housing, about food, about shelter, about healthcare, all of these things that are absolutely essential for families.
Absolutely. No, I couldn't agree with all of that more. Anything else to add, Suzanne, before we wrap this up?
Just if people want to get more information about what's happening in their state, childrentrustmichigan.org. There's lots of information there. If you have any questions, you're welcome to direct one to us at our office at 517-241-0042. We are so happy to talk with anyone in the community that's interested in preventing any of those. And maybe you have a question. Happy to always talk with people about the great work that's happening in their communities.
Absolutely. And this is a priority of ours, obviously, at Michigan's Children as well. So you can find more information and follow along as we progress through the budget process here at michiganschildren.org. Well, I want to thank Bart and Suzanne for joining us today to talk about this very important issue, but also most importantly, thank them for the work that they do on an everyday basis to help prevent child abuse and neglect in Michigan and throughout our country. And thanks everybody for tuning in, and tune in again next month for another edition of Speaking for Kids, a podcast brought to you by Michigan's Children. Thanks and have a good day.
You've been listening to Speaking for Kids, the podcast for Michigan's Children with host Matt Gillard. Thanks for joining us. To explore these and other issues relevant to our state's children, youth, and families, and to build your advocacy muscle, go to our website at www.michiganschildren.org. You'll find links and news about past and future podcast topics under our Resource tab and action alerts under the Take Action tab. Find and like us on Facebook and Twitter. Stephen Wallace produced this podcast. Contact them with your questions and ideas for other topics. Michigan's Children is a nonprofit advocacy organization, an independent voice working to reduce disparities in child outcomes from cradle to career through policy change.